This patient was referred to me a year ago for evaluation, examination of teeth number 13 and 14. According to the patient, the root canals and the bridge were done over 20 years ago in Ukraine. When I saw him a year ago, patient told me that he had noticed that now he couldn't chew on the left side and complained of some swelling above these teeth also. So when I examined the tooth, I noticed a 4-unit bridge from number 11 to number 14, old, worn out bridge. All the porcelain was chipped off and missing. Of course, it's a 20 some year old bridge, so it makes sense that it'd be all worn out and chipped. And I also, when I palpated just superior to teeth number 13 and 14, I could palpate a hard mass above these teeth. And again, you can see, if you look at the radiographs here, you can see a periapical lucency associated with tooth number 13 there, and number 14 also. And these are, as I said, these root canals, according to the patient, were done over 20 years ago in Ukraine. And this is how they do root canals in Ukraine. Just they use Russian red paste. This was not, later on I found out this was not, this and this right here were not Russian red paste. They were actually gutta-percha, but the rest of the canals were filled with Russian red paste. Here it was all Russian red paste, and you can see a periapical lucency there. But you can actually see that number 13, for example, number 13 was actually instrumented, and canals were instrumented and prepped, but then they were obturated with the Russian red paste, and again you can see a periapical lucency there. Probings were 2 to 4, 5 millimeters all around. So, and again, remember, I palpated a hard mass right above teeth number 13 and 14. And as I said, I saw this patient a year ago, and here's the date. So we talked about options with the patient. The patient really wanted to try to save these teeth. And I told him, I talked to him about the Russian red and how hard they are sometimes to remove. They set like concrete, very difficult to go through sometimes and remove. And the goal here, our goal, is to be able to go all the way to the end of each canal, each root, each canal, and just flush out all the perhaps tissue that was left behind and bacteria and their products. And sometimes we can't do that when we're dealing with Russian red paste or blockages and ledges and what have you that the previous clinician had left for us to deal with. Patient really was motivated to try to save these teeth, and that's what we did. We started with tooth number 13 first, and then patient came back a few days later, and then we worked on tooth number 14. But I made my endo access through this old 20-some-year-old bridge, got inside, and of course this was all obturated with Russian red paste. Had a really hard time removing the Russian red paste. I finally was able to remove them, and then I noticed a strip perforation. You can see how much dentin was originally removed by the previous clinician. So I noticed a strip perforation in the palatal canal's buccal wall. All right, so I let the patient know right away. All right, so let's go to here. You can see that I was able to regain patency in both canals of tooth number 13, and you can see the periapical lucency there again, and some root resorption, apical root resorption also, as you can see. But I was able to remove all the Russian red from buccal and palatal canals of tooth number 13, regain patency, and I was able to redo this root canal for him in one appointment. I placed MTA to try to repair that strip perforation that was associated with the palatal canal's buccal wall, and redid the root canal, as I said, for him in one appointment. And this is the post-op So this is all MTA to here, and then the rest of the canal, the buccal canal and the rest of the palatal canal, I was able to obturate with gutta perchance sealer. But from here to here is MTA, and you can see the periapical lucency there also. So this is, again, another angulation, and you can see the periapical lucency there, and this is all white MTA followed by gutta perchance sealer, and the buccal canal I was able to obturate fully with gutta perchance sealer. And again, you can see the periapical lucency there. So patient came back a few days later, and I started working on tooth number 14, endo access again through the old 20-some-year-old bridge. This was gutta percha I was able to remove. As you can see, the buccal canal was obturated with gutta percha, but I was not able, for the life of me, I was not able to regain patency. I was not able to regain patency in that canal. Just couldn't regain patency. I found a missed MB2. Let me show you. So my MB1, I regained patency, located a missed MB2. The palatal was able to remove all the Russian red paste and regain patency in the palatal canal. Distal buccal canal, I was not able to regain patency. So here is the post-op of the tooth number 14 right here. So as you can see, I was able to regain patency in the MB1 canal, located the missed MB2 canal. Palatal canal, I was able to regain patency. I removed all the Russian red paste. And distal buccal, I just, for the life of me, no matter how hard I tried, I could not regain patency. The apical diameter of the palatal canal was over 60, so I placed an MTA plug here. I redid the root canal here in one appointment, just like redoing when I redid the root canal on tooth number 13 in one appointment. So again, here's the post-op. Here it is. Just different angulations here. It's kind of blurry. So I think here we go. I think the best one is this one, where you actually see the MB1 and missed MB2 that we're able to locate. Distal buccal, I could not regain patency. And then that's the palatal. You can see some apical root resorption associated with the palatal root also. Placed an MTA plug here because the apical diameter was over 60, followed by gutta perchance sealer. That's the distal buccal that I could not regain patency. So again, remember, patient had a hard mass right superior on the buccal side, right superior to teeth number 13 and 14. Well, patient came back today for his 1-year post-op. And again, you can see that's when I completed the endodontic retreatment of tooth number 14, as you can see, a year ago, right here. So patient came in today for his 1-year post-op, still has the same bridge. You can see open margin there a year ago when I told him all of that. And here's the 1-year post-op of teeth number 13 and 14. That buccal mass, the buccal mass that was superior to teeth number 13 and 14 is completely gone and healed. Patient has no symptoms whatsoever. You can see the periapical lucencies have healed completely. That's the distal, that's the tooth number 13. You can see no periapical lucencies, healed completely. Look at the number 14 here. Perfect here. That was MTA, remember, MB1, MB2. Remember, I couldn't gain patency in distal buccal. It didn't matter. Didn't matter. Patient is asymptomatic. That buccal mass superior to teeth number 13 and 14 healed completely, gone. As I said, patient has no symptoms, still has the same bridge from 20 some years ago. Here's the date when I see him today, his 1-year post-op. And again, I try to motivate the patient to get a new bridge, and I think I was able to finally convince him. But as you can see, 1-year post-op of teeth number 13 and 14, And what we did worked, and that mass is gone, that buccal mass superior to teeth number 13 and 14. They both responded within normal limits to percussion and palpation. Probings were 2 to 4 or 5 millimeters all around. And here it is, 1 year post-op of teeth number 13 and 14. And again, here's the date. So life gave us lemons and we made lemonade. Everything worked out great for the patient, and here it is, 1 year post-op of teeth number 13 and 14. This was MTA. Remember, there was a strip perforation here that we were able to repair, probings within normal limits, and here we put an MTA plug here, and as I told you guys, perfect. 1 year post-op of teeth number 13 and 14.